Caregiving is not a one-person job. At Arden Courts, we know, we understand, we can help. It's all we do. That's why family caregivers turn to Arden Courts for help when going it alone isn't working any longer. That's the case of Tom and his wife Laura. Retired and living in their golden years, Tom and Laura had a good life, traveling and enjoying each other's company. Then Tom began to notice Laura doing strange things that could not be explained. For instance, a fastidious housekeeper, Laura started to dust the furniture using hairspray instead of furniture polish. When Tom questioned Laura about this, she got angry and made it sound like it was Tom's fault. Laura was also very organized and was in charge of paying the couple's monthly bills. But when some bills were paid twice and others not at all, Tom was very concerned. When he approached Laura about this, she denied there was a problem and made up excuses for the mistakes. Another time, Laura was baking her famous oatmeal cookies for Tom as she did every week, except this time, Laura used cornmeal instead of oatmeal. Someone must have switched the contents of the container, she said. Finally, Tom called their family physician for answers. After a complete physical and many tests to the specialist, Laura was diagnosed with dementia of the Alzheimer's type. The news was devastating to Tom. Laura claimed the test and the doctors were wrong. Tom and Laura went home, and Tom became a caregiver to Laura. He did the best he could to keep Laura happy, safe, and physically healthy. Eventually, Tom was feeling the effects of full-time caregiving. He visited his family doctor, who saw that Tom was drowning in the sea of caregiver stress. The doctor said that Tom had high blood pressure and other health issues related to the stress of being a caregiver. The doctor threw Tom a lifeline when he recommended that Tom call Arden Courts Memory Care Community for help. Tom toured his nearest Arden Courts with the marketing director. After discussing Laura and her needs with this dementia care professional, Tom realized Arden Courts would be the right environment for Laura. She would be in a safe and nurturing home-like setting. Laura would have the support and care she needed as her dementia progressed. Tom also discovered that Arden Courts staff was there to support him too. He was invited to attend the free caregiver support group meetings held at Arden Courts, where he was in the company of other caregivers experiencing similar issues. There, Tom received valuable information, encouragement, empathy, and emotional support from the group. After attending a caregiver support group, Tom realized that it was time to take the next step and schedule an assessment. This short social visit, usually done at home, although sometimes at a daycare center, a rehab center, or hospital can be the assessment site. The assessment verifies that a resident will meet the state's assisted living criteria. The visit also helps Arden Courts gain valuable information about Laura's likes, dislikes, and any special needs in order to create her customized service plan prior to moving in. The visit went well, and Arden Courts accepted Laura as a resident. Tom scheduled time with the executive director to complete a move-in packet. Additional information about Laura is gathered at this time to add to the customized service plan, such as diet, favorite foods, bedtime ritual, and bath time rituals. There's always paperwork to be done, but don't be daunted by that paperwork because we're professionals and we're here to help you through it. Getting the residents' rooms set up is also very important, as Arden Courts is a home-like setting, and as such, resident families are encouraged to provide familiar items from home for their loved one to enjoy. Items such as a favorite pillow, pictures, or souvenirs can evoke pleasant memories. Laura liked to collect dolls, so the day before move-in, Tom brought some of her favorite ones to decorate the shelf in her room. He also brought her favorite Afghan as a warm reminder of home. Individual photos of family and longtime friends were included in Laura's memory box right outside her door. The pictures will assist Laura with the location of her room and also serve as a way for staff to engage Laura in conversation about familiar people.